Michigan is now reporting 2 deaths related to the outbreak of cyclospora. According to the CDC, death from the parasitic illness is extremely rare. This summer, thousands have gotten sick from the parasite, and now Democratic Senator Richard Blumenthal is accusing the Trump administration of a politically motivated cover-up. He's calling for an investigation.
Not only have they dropped the ball, but very likely because of political influence. Taylor Farms contributed $1 million to a Trump PAC. They called the White House to delay the recall. The outbreak was in May. The recall was delayed until July.
CBS News medical correspondent Dr. Céline Gounder is here. She's also the editor-at-large for public health at KFF Health News, and she can help us understand what proximity does and does not tell us as far as this outbreak. Dr. Gounder, good morning and welcome. So as one senator alleges there's a government cover-up happening, the rest of us just want to stay safe. We've got these 2 reported deaths out of Michigan. What do we know about them, and what does that mean?
Well, both of these people had significant underlying conditions. So if you're somebody who's elderly, you have chronic kidney disease, chronic congestive heart failure, any number of different conditions, having severe dehydration related to cyclosporiasis can actually tip you over the edge, can land you in the hospital, and in this case, in these 2 cases, even be deadly. In general, cyclosporiasis is not life-threatening. I think it's important to emphasize that. And these are the first deaths that are associated with this outbreak.
Still, nobody wants to get it. It sounds pretty uncomfortable, right? We are speaking of digestive issues and an explosive type of issue. So how big has the outbreak become, and how can people truly protect themselves?
Right. So Michigan has counted more than 11,000 cases. And just to put that into perspective, in a typical year, the state sees about 50 cases. So wow. 50 versus 11,000. Michigan appears to be the hardest hit state, but at the same time, they actually had a very robust public health response. So they may just be doing a better job of counting.
Okay, than other places. Mm-hmm. It sounds like a huge amount of people, though. So what should people be doing? Is this washing produce? Is it not eating lettuce? What's the real protective action?
Yeah, so a reminder with cyclospora, washing your produce, even if you're using something like bleach, is not going to do it. And I'm not suggesting we bleach our produce. But this is the problem. This really does require a public health response. Some of the things you can do in the interim while this is getting settled is cooking your produce. So keep eating the fresh produce, but cook it or peel it is the other way to reduce your risk significantly.
But food experts are pointing to something bigger than this one outbreak. So what are they saying about the system in general?
Right. So remember last year, there were a number of cuts to various different public health programs across the board. One of them is called FoodNet, which is the main tracking program looking at that time, it was 8 different pathogens. They cut it down to 2, so now only E. coli and Salmonella. One of the ones they cut was cyclospora in terms of nationwide monitoring. And that was really to provide a baseline. And then you're looking sort of the signal to noise, like how are you seeing blips above the baseline? And that provides that early warning system to know something is happening.
So we could have had an early warning here. Are you still eating salads?
I am not eating iceberg lettuce. I am still eating salads.
Okay, that's the news we need. Dr. Gounder, thank you so much for this clarity. We need it.